Are you wondering how long masks are going to be part of our daily routine? Me too. I'm Lisa Oyer with the Columbus Medical Association, and while I work with physicians every day, I'm also, like many of you, a mom here in Central Ohio, trying to keep my family safe and sane during the COVID pandemic. Today, I'm joined by Becca Glowinski. Becca is a OSU medical student and also involved in research in infectious disease. She's going to help us understand the what, who, and why of wearing masks. Hi, Becca. So glad you could join us today.
Hi,
So,
thank you for having me.
yeah, we appreciate your time. So, can you kind of tell us the science behind why masks are so important and effective in helping stop the spread of COVID right now?
Yeah, so the primary way that COVID is spread is through what are called droplets, which are just, small little bits of fluid from your nose, from your mouth that everyone exhales and expels while speaking, breathing, just existing. There's really no way to prevent them. But what masks do is they put a barrier in front of your face, in front of your nose and your mouth, so that those droplets don't go out into the world and don't go into someone else's nose or mouth and infect them. And so really, because in COVID, we know that sometimes people can be contagious even when they don't have symptoms, either before they have symptoms or just be completely asymptomatic during their infection. It's really important that everyone wears masks, even if they feel healthy, because then they're protecting those droplets from going out and potentially infecting someone else if they do have COVID.
Okay. So the who is pretty much everybody, I'm guessing.
Yes.
Um, can you tell us about the when we should be wearing them?
Um, Pretty much any time that you're with someone who isn't in your immediate household. So people that you don't live with daily, you should be wearing a mask when you're anywhere near them. And that includes inside, outside, even if you're able to socially distance yourself from them, so more than 6 feet away, it's still good to wear a mask just because, it's that second layer of protection. It's that second sort of precaution that we can take to really prevent any potential spread.
Okay. One question I think a lot of us are still trying to figure out is what kind of mask to wear. You know, you have your N95s you hear about, the gaiters are out there, you see the people with the full face shield, and then just the fancy ones you can get to go with your outfit. What are your thoughts on some of those?
Yeah, so the differences between all of those types of masks really just are in terms of how much particulate they protect from leaving. So I guess I should rewind. Face shields are a little bit different. They just sort of protect mucous membranes, so that includes your eyes, your nose, and your mouth. And they're not really blocking the droplets because they're not as close to your face as some of the others. So really, you see them used in conjunction with masks to protect people's eyes and things like that. So they don't have really that particulate, and what I mean by that is those little droplet, they don't have that particulate blocking ability. But for all of the others, like homemade masks and 95s, the difference is how much is able to get through. So all of them block particulate to a certain degree. But N95s are called that because they block 95% of
Oh,
droplet particulates that are going through. And so they're really the most effective. However, cloth masks and things like that are still pretty effective. The more effective ones tend to be more layers, or if they have a higher thread count,
okay.
those tend to be a little bit more effective. But honestly, anything that you're able to wear consistently is going to be the most effective. And really, the N95s right now tend to be for healthcare workers, people that are dealing with COVID patients regularly, things like that, where they really need that full seal and full protection. Whereas the rest of us, as long as we're also taking those other precautions, cloth masks should really be, as useful as we need.
Okay. Interesting on the N95. I didn't know that's what that was for. I just kind of went along with it. So,
There are actually N99s, I believe, as
wow,
well, but they're even more rare than
I'll bet.
N95s.
I'll bet right now. Okay, so here's a little fact or fiction game. Perhaps we can play on masks, um, based around misconceptions or facts that we hear out there. So one of them is you hear a lot about people saying that wearing a mask um, causes carbon monoxide or carbon dioxide buildup when they're wearing them. Is that true?
No, no, the complete fiction. So really, just the fact that we're able to breathe through the masks kind of disproves that. The fact that oxygen can flow in, so we're not suffocating as we have our masks on, means that carbon dioxide can also flow out. And the size of these gas molecules are so small compared to droplets, viruses, everything, they can easily fit through that, even the highest of thread count masks, they'll be able to go through, and you should not have any carbon dioxide building up.
Now, another fact or fiction, you should only wear a mask if you're sick.
Fiction. So, as I mentioned earlier, we know that people can be contagious even before they start showing symptoms, or some people don't even ever have symptoms while they actually have an infection. So, even if you don't feel sick, there is always the potential that you actually do have COVID and can be spreading it in your community. So, even if you feel completely healthy, you should still be wearing a mask, just because we know that helps really prevent the spread within your community. And additionally, there's a little bit of research that shows masks can actually protect you as well. We started off the pandemic with everyone saying wear a mask to protect other people, but it really goes both ways. By wearing a mask, you're both helping your community and helping yourself stay safe.
If you've already had COVID, do you still need to wear a mask?
Yes. So we do know that it is possible to get reinfected with COVID. We don't have a whole lot of information on that yet, but we've seen a couple instances. The more concerning situation is if someone's had COVID and recovered and then gets reinfected but is asymptomatic because they've already had it, then they may not know that they're sick, may think that they're completely healthy and immune, and can go back into their community and continue spreading it. So even people who have had COVID, who are completely recovered, we still want them to be wearing masks to prevent any community transmission from themselves as well, even
Okay,
though they're probably immune at that point.
gotcha. Well, and I'll just wrap it up with a question of, when do you think it's over? When do you think we can stop wearing masks?
I
If
don't really
ever.
want to give you, I don't want to give you like a hard timeline there because I've been wrong in the past year. But I think what's important to keep in mind is that we continue masking even as we go through this vaccination campaign for several reasons. First of all, even once you get a vaccine, it does take a few weeks for your body to build up that immune response to it. Second, we don't really have any data yet on what's called sterilizing immunity. So that means if you get the vaccine, does the vaccine prevent you from getting infected at all? So we don't know if people who have the vaccine can still have asymptomatic infections, which would still be great. It would still help prevent a lot of the severe disease and even mild symptoms. But if that's possible, then those people who have the vaccine who think that they're completely immune and aren't wearing masks could go into the community and be still spreading the virus if they think that they're completely healthy. And then finally, just like masks aren't 100% effective, vaccines are only 95% effective, which is still amazing. It is fantastic that we have that level of protection, but we should consider the vaccine, again, just like another tool in our toolkit of precautionary measures, just like masks, just like social distancing, just like washing hands, as just another thing that we're doing to make sure that we can prevent the spread, get this pandemic under control.
Well, thank you. You definitely reaffirmed some of the things I thought I knew, and then I learned some new things. So we really appreciate you clearing up a lot of stuff for us here.
Yeah, glad to do it.
Thanks so much, Becca Glowinski, for helping us better understand the reasons why wearing masks is still very important. I have a lot more questions, and I'll be asking other experts around Central Ohio to help us understand how to get through the COVID pandemic. So stay tuned for more interviews to come. And remember, what we do together counts more than ever.